Babe, class you are on. No, I said I should inform you. Why I go? I'm actually. Hello.
Hello, good evening, everybody.
Yes.
All right.
The lecturer is there. Good evening. Good
Good
evening.
evening, ma'am.
Good evening, ma'am.
Good evening, ma'am.
Good evening, doctor.
Good evening, ma'am.
Are we all together? Good
Yes,
evening.
ma'am.
Are we all
Yes,
together?
Doc.
It's supposed to be a combined class.
Yes.
Good evening there. Good evening.
Good
Yes.
evening.
Supposed to be a combined class. Are we all here? Good evening.
Yes, Doc. I informed the.
Okay, fine. So, um, I have sent the slides earlier. Yes. Did you all get the slides?
Yes, ma'am. I received.
Who is speaking?
Yes,
Who
ma.
is speaking?
Yes,
Did you all get the slides?
Yes, ma.
Okay. All right. So who I gave the slides to should share.
Good evening, Doc. Just like an
we
observation,
are
your
talking about rehabilitation. Yes, what's the observation?
your network is quite poor. We are not hearing you well. Maybe if you can switch or something.
What's the observation?
Your network is we can't hear you
Technology.
well. We can't hear you well.
Let me change my place.
All
Let
right.
me sit.
We can't hear anything, ma. Please, kindly check your network, ma.
Can you hear me now?
Yes, ma, it's better.
It's better, okay. Because the network is unstable, I'm going to run. We should be able to discuss a lot in 30 minutes, in 1 hour, and then bonus time. We are looking at rehabilitation. Who got the slides should please share so that I won't give you a wrong slide. Share. We are looking at rehabilitation. Rehabilitation. When you talk about rehabilitation, it means that you're putting back what was there before and maybe had a problem or damage or became abnormal. You are trying to put it back. So rehabilitation, to rehabilitate somebody, to rehabilitate something, to repair. You know, repair is different from rebuild to a fresh build. So repair, rehabilitation is like repair. All right. So are we sharing the slides? Is this the slide everybody has, the one that I have on my screen? Okay, somebody is sharing. Yes, it's the same
Yes, ma,
slide.
yes.
Very good. Okay, so
Okay, sorry. And the person sharing, I think your screen is not big enough. So I would like to override yours and share mine, if you don't mind.
okay, please agree with yourselves because my screen is not so big. I need to move out. I had to move out. I'm using my phone. Oh, all right. If you haven't shared before, if you haven't started sharing, I can read what I have. Rehabilitation aims to make possible persons handicapped by diseases or injury to live a normal, fairly normal or near normal life. Rehabilitate the person. We can give so many examples. Rehabilitation is not a cure. The person still has the problem, but you just enable the person to live better, to be more independent, to live a normal or near normal life. Like as I speak now, I'm wearing a pair of eyeglasses. That is rehabilitation. Without the eyeglass, I can't read the small prints. All right. So the eyeglass I'm using has rehabilitated me. I cannot read. I can teach I can lead a near normal life or normal life. All right. So that is rehabilitation. There's a word you are going to encounter down the road. It's called habilitation. Habilitation. The person sharing, I can't get your slides. Okay, I've seen it now. So next slide, please. Ikenna, next slide. All right, there's a word on top there that says habilitation. All right, habilitation is different from rehabilitation. Habilitation, the person did not have that function at the beginning. It's like somebody born blind. If you are partially sighted, that is habilitation. Some people have limb cuts. If you can do anything to make the person walk better, is habilitation. Congenital abnormalities most of the time, when the person, the patient, the client gets assistance, gets intervention, and be able to manage that part of the body better, that is habilitation. All right, as against rehabilitation. There was a loss, there was an abnormality. All right, but in habilitation, it was never there. All right, so the other word is a physiatrist. I'm sure many of us have seen this word for the first time. Is a medical doctor who specializes in neuromusculoskeletal system. All right, he is usually the team of rehabilitation. All right, okay, that's a physiatrist, a doctor, a medical doctor, someone that has MBBS and maybe specializes in rehabilitation, physical rehabilitation, is called a physiatrist. Next, please. Okay, there is a physical therapist, that's a physiotherapist. Okay, next slide. I'm just giving you some keywords. Next slide. All right, occupational therapy. Please jot this down. I want you to read it up to know exactly what is occupational therapist. When you see the word, it's deceptive. Do not confuse this with vocational therapy. So you must read it, define them, differentiate between occupational therapy and vocational therapy. Please, very important. I didn't say underline my screen, okay? So you write it down in your book, the difference between occupational therapy and vocational therapy. Speech therapies, yes, there are people that are born with speech impediments. There are also people that get sick. It could be cancer of the throat. It could be, the most common is stroke. It's speech therapists that teach them again how to talk. All right, next slide. Recreational therapy provides leisure time activities to the individual. Recreational therapists. I know somebody that was studying in UK, and they said as a student, even secondary school, A level, you need to volunteer. And while you volunteer in like elderly people's home, in other centers, part of your activity assigned to you is to take them for recreational therapy. You take them to cinema, for window shopping, for shopping, to dancing. That is recreational therapy. Okay, can we go back to the last slide, please? Okay, so vocational therapy, vocational counselors, social worker is interested in the person's social history, his family, and all the problems surrounding, all the social problems surrounding the person. Then nurses are also part of the team. Next slide. Next slide. Psychologists, all right, we work on the person's psyche to be able to accept your injury and then accept treatment and rehabilitation. All right. Rehabilitation has been very successful in making it possible for the handicapped to live and work productively. The big job of rehabilitation now is the education of general public. All right. So what does that mean? That the big job of rehabilitation is to educate the general public. What does that mean, or what does it entail? I just want input from the class. Why are we interested in educating the general public about rehabilitation? Hello, class.
Hello,
Yes,
ma.
I say, why are we interested
Hello, ma.
in
Hello, ma.
educating the general public? Just say your name and give some answer.
Okay, ma. I'm Chinele Angela. I would say maybe to avoid disability.
Avoid disability. Go ahead.
My name is
How do you
Jabari.
avoid disability? You tell them about physiotherapy, about other rehabilitative measures. So when they have problem, they will know where to go. They know there is remedy, at least near remedy. More answers from the class, please.
Hello, ma. This is Nelly.
Yes, go on. Yes,
So that
Nelly.
we can also avoid stigmatizing them and also offer them needed help where necessary.
Yes, stigmatizing them. The days we used to have on-site classes, when we do field trip, I take students to our physiotherapy department, the speech therapists, the psychologists, and other rehabilitative centers, the audiometry room, and they will teach them. At the end of the day, they're usually surprised. Oh, I didn't know this is going on here. I'm going to bring my aunt, I'm going to bring my grandmother, I'm going to bring my mother for physiotherapy. They're just there languishing in the house. So when you also educate them, they will know when you have this problem, there are places you can get it done faster, and the person will lead an independent life. There are other reasons, but let's move on. Next slide. Next slide, we've discussed. You read, please. Next slide. Next slide. This is not our main. I'm just introducing you to this. Remember massage. There's a time a part of Port Harcourt was so known for massaging, especially women that are pregnant, or those that are not pregnant, or those that are that have some fertility problem. They will go for massage. It was raining. That part of Port Harcourt, inside the city here, the women were making money, a lot of it from massage. All right. So massage is a technique of manipulating the soft tissues of the body, such as the skin and muscles, but not the bones, with the hand. So physical therapists do this a lot. All right, but those women in that part of Port Harcourt were not trained. They were native trained, and they used to make a lot of money. Pregnant women will go there, they will massage them, especially towards their delivery time. They will say, when they massage you, you just deliver. But then when we started having problems too, people started having problems. That trade declined. People have stopped going there. Next slide. Remember these masters, I gave you the slide so that you can read. Okay? A legally authorized practitioner of medicine is called a physician. Physicians who receive a medical degree after fulfilling all that. So physicians are also part of the team of the rehabilitation team, surgeons, everybody, they're all part of the team. Next slide. Okay, physiology is a branch of medicine. It's a branch of biological science which deals with the function and interrelationship of the tissues and organs of the body. That's physiology. What is this? So physiology tells us how our systems function, our tissues function. That's what physiology teaches us. How the heart function, how the heart receives oxygen, pumps blood, receives blood back to the heart, goes down, is all physiology. How our neuro system functions, that's physiology. How our muscles are contracting and relaxing, that's physiology. Our endocrine system, and all part of our systems, all part of our body, that's physiology. And when there's a problem in our physiology, it can lead to handicap, disability, and may need rehabilitation. Okay, most of the time when this happens, you need the physician, you need the surgeon to see it. Hello. Next slide, please. Next
So
slide.
that's the end of this slide. That's the end of the
Okay,
slide.
so you have another slide. Can you start sharing it while I answer Busayo? I don't know why it's calling me. So can you share another slide, please? That's just this is like introduction. That's the real work.
Please, I want to suggest if your laptop is giving this mark, please can another person share? We struggle to see the previous slide. It was very, very blurry and stressful to the app. Thank you.
Okay, someone else can share. I'm trying to also remove it from here.
But you're not permitting sharing of screen. Yes, ma'am.
There's another slide on rehabilitation. Don't you have it? There's another slide on rehabilitation. Don't you have it?
Okay, so I just received two
Hello,
slides.
Ikenna.
Yes, talk.
Only
I
two
received
slides.
2 slides from,
Okay.
yeah.
Okay, there's another slide on rehabilitation, very long slide, but let me take this since I've started sharing it. After that, we'll look for that one, okay? So we're talking about elder abuse. If you check your timetable, you're going to see it. We know about child abuse. There's also what they call elder abuse, abuse of the elderly, you know, people 60 years and above. In fact, anybody older than you, if you abuse the person, it's elder abuse. But usually we say the elder people is elder abuse. Okay. So next slide, please. Every person deserves to be treated with respect and with care. Everyone, no matter how young or old, deserves to be safe from harm. You can see it. All right. By those who live with them, care for them, come in day-to-day contact with them. Come in day-to-day contact with them. Next slide. We have to look at epidemiology, types of abuse, risk factors, warning signs, barriers to reporting, management and prevention. Next slide. It is an act or omission, commission, omission. What you did willfully or what you forgot to do, what you omitted in doing, which results in harm or threaten harm to the health or welfare of an individual. Usually a person over 60 years of age. All right, so like we defined epidemiology in epidemiology, is study of DDD, distribution, determinants, and deterrence of disease and health-related events in human population with the aim of prevention and control. Right. So in defining elder abuse, you just put the word abuse. Elder abuse is the study of distribution, determinants,
Yes.
of elder abuse. All right. So that is it. As a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust. Which causes in this sentence, please? My network is glitching. Can you hear me?
Yes, we can hear
Can
you.
you hear me? Okay,
Yes,
so can
yes, we can hear you.
you
Yeah.
explain, especially where there is expectation of trust? Can somebody quickly, please be fast so that we can manage within this network? Expectation of trust. Explain this sentence, please.
Let me try. You said a single or repeated act
Yes, you go to
or
try
lack of
quickly or whoever.
appropriate.
Yes.
A single or repeated act or lack of appropriate action occurring within any relationship. That's where someone is having an association with an older person, and by whether at a single point of communication or by repeated action is causing a harm or distress to the older person, is an abuse to the older person.
Good. I want you to explain expectation of trust, because that's the crux of the matter. If I'm on if somebody is on the road, an elderly person is on the road, and somebody is crossing and maybe slaps the elderly person, you might just say it's assault. But
Yes,
if you are in a relationship, there is trust. Like within me now, there's a 5-year-old child that is not far from where I am. That child expects me to protect her. There's expectation of trust, of protection from me. You see, that sort of thing. So the elderly person expects love, expects charity, expects protection, expects safety to be, around that person. So there's an expectation of trust. There's a relationship, and then it is abused. Instead, there are repeated acts or even a single act that may cause harm to the elder person. So I've explained it further. I want someone else to try to explain it again.
Hello, ma'am.
Go ahead.
Okay, it can also happen maybe in terms of caregivers. Like in the abroad that they have caregivers and you are entrusted to take care of this elderly person.
Why are you talking
And the
about abroad?
person
We are
now
here
abuse.
talking about Nigeria first. Talk about Nigeria, not abroad. Talk about Nigeria. This is where we are. We have elderly people around us. We have parents, grandparents, in-law, mother-in-law, father-in-law, uncle-in-law. We have aunties too. So talk about here, not even our neighbors. We're supposed to look after our neighbors. Okay, co-workers that are in that age group, not abroad. So go ahead and tell me.
So as you have explained, but it also include can it also include occupational? Maybe we are in the, like some of us are in the healthcare sectors and we have the obligation to take care of the elderly in the workplace. Then instead we use the opportunity to abuse them. Can it also
But they've come to you, there's expectation of trust, isn't
yes,
it? That's why
yes,
they came. That's why they came to you. There's expectation of trust,
yes.
of a relationship. They've come to you trusting you to take care of them, for you to be responsible towards their problem. So it is abuse. You get it? If you don't do the needful or you omitted to do it, it is abuse. So a lot of us that are lazy, negligent in our activities, in our work, it's elder abuse. All right, let's move slide. Next slide. Okay, repeated act or action or omission. So please, even those of you that don't call your parents, your grandparents, quarrel with your mother-in-law, father-in-law, it is abuse. You don't call them, don't talk to them, you don't know how they are doing, how they are feeling, you give them mental whatever. So it's either omission or commission. So let's not do that. Don't be found guilty of elder abuse. Okay? So the estimates vary widely due in part to variability in definitions used to measure and report abuse. Most abuse are not reported. Mistreatment of adults, including abuse, neglect, exploitation, affects more than 1.8 million older Americans. We don't have people in Nigeria. Self-neglect is also a form of abuse. If you allow an elder person to self-neglect themselves, you that have allowed them, you have perpetrated elder abuse. So they have the self-neglect, but people, when they allowed it, you look the other way, or you are angry at them, or you are negligent, or you refuse to for them, you have perpetrated like. Next slide, please. Ugochukwu. Ugochukwu, okay. All right, distribution according to Wolf 2000 said to be equally divided between male and female. Some studies say that females are more often abused or more often abused. All right, I said the studies that said females are more often abused. What do you think is the reason that was, they reported that? Hello, class. Let's be active, please, so that we can finish on time. Why do we think those studies that say females are more often abused than males reported that?
One factor is that females live longer than men.
Hello? Okay, good answer. That's one. Two. Have you noticed that when women are bereaved of their spouses, most of the time they don't remarry? But the males are usually marry more often than females. So the women don't remarry, they stay alone. And when you are alone like that, you are subject to more abuse. So they live longer one. They also don't remarry when they are bereaved of their spouses, or even after divorce, they don't remarry most often. But the men, they marry. Are there other reasons?
A lot of women
about their
usually have lower socioeconomic power, just given that most women
Excellent.
depend on their
Lower socioeconomic, yes. Lower socioeconomic. Very good. Thank you for that.
another one
Yes.
can be social
Any
behavior.
more? Very good.
Another
Lower
reason is that
socioeconomic, yes.
women
How?
they're more likely to report the abuses than men.
And also,
Good.
in terms of political
People are really
class,
thinking.
in terms of political class, women are not being given the opportunity. So at that point, I feel it is still abuse as well.
Yes, I agree. Or even when women report, sometimes they don't take them seriously. They laugh at you, you know. They don't take you seriously. They say it's a family matter. Go and settle it. They don't even believe. Okay, so that's very good. Next slide, please.
Some are not
Okay, just
financially
hold on.
independent.
Just hold on. No, go back. Yes, somebody had said so, not financially. Let's women, okay? All right. As Latinos, Caucasians, and Asians. Next slide. Okay, types of abuse. You can see physical abuse, sexual abuse, neglect, psychological stroke, emotional abuse, financial abuse, and others. Next slide. Okay, physical abuse, you have assault, real physical handling, assault, battering, beating, okay? Continuous or prolonged deprivation of food or water or medications. This is common. Children of cows, line up canopies, invite their friends from far and wide, but when the person was alive, the person is deprived of good life, you know, so that is abuse. Use of physical restraint for punishment, conveniences without or beyond the scope of the doctor's. All right. Sometimes the people are tied up because they are violent and they tie them up, restrain them, lock them up in the house. All right. Physical abuse, pushing, shoving, slapping. All right. Next. Next, sexual abuse, any kind of non-consensual sexual contact is sexual abuse. Even showing an elderly person pornographic material is sexual abuse, or even showing exposed body, someone else's exposed body, sexual abuse. Next slide. Neglect, very important, very common. Failure to provide necessary physical or mental care to an elderly person, such as failure to assist in personal hygiene, provision of food, clothing, shelter, provision of medical care, to protect from health and safety hazards. This is neglect. This is not even self-neglect. It is elder abuse when the perpetrator does all these things, and it is common. We live large in townships, but many of our parents and relations are suffering. There's this fracas that happened in the plane. I saw something trending about the girl's father being a tailor in the village, big, and things like that. She's on TikTok, Instagram, and all that. She has an iPhone, but the father is a common tailor that is just barely surviving. I don't know if it's a true story, this part of the father, but you see, that is the abuse. You cannot be flying big class, first class, using iPhone, living big, living on Instagram and Facebook, and your father is struggling in the village. That's abuse. Next slide.
I have a question about
So
that.
let's not neglect
I have a
elder
question
persons.
about that.
Go ahead.
Yeah, I'm not sure how that can be categorized as abuse or neglect. Because just a child having means and quote unquote means, especially in Nigeria, using an iPhone oftentimes doesn't equate having resources. Some of these people could be a boyfriend or something. And like from trying to identify abuse from like a more like how do I say it? Professional way, we can just equate, because I feel like we can just use one information like, oh, they have an iPhone or they are flying first class, to then judge that that's abuse of parents or neglect when we don't know the full picture. So I wonder if that's something we should be cautious about labeling as abuse without knowing the full details of what's really going on. And Dr.
Okay,
Odua Nkata,
you made your
please,
point.
you can
You
ask
made
your
your point, but
questions
as an
without.
offspring, you should do your bit. If your parents are alive, no matter what, do your bit. Elevate their standard. Do your bit. That's the truth. And taking care of one's parents or the elder is very, very rewarding. Even the Bible talks about it. I believe the Quran also talks about it. So I didn't even mention name. I said something trending. The part of the tailor, the father being a tailor and looking for the daughter is not even on speaking terms with him. I don't know if it is true, but I'm just trying to bring it up that some things that happen to us on a daily basis like that, our lives might just be neglect. That's what I'm trying to bring up. Okay? If I have a boyfriend that will give me iPhone, it means that I can also get something to make my father comfortable. Live a little bit better than he's living. That's what I'm trying to say. We shouldn't forget the elder. We should remember them, housing, food, whatever. If that man, if he's true, has a problem tomorrow, will she be able to? Is she close enough to solve the man's health problems, financial problems, psychological problems? But what happens is that when the person dies, oh, There'll be cows lined up. There'll be canopies. Friends will fly for here and there. There'll be a shady all over. No, it should not be like that. I'm just trying to make us change, not you in class. But when we're communicating, we need to learn these things and be able to communicate to others. You came to school not just to pass, it's just for you to also communicate some vital knowledge, information, skill to others. So that's just it. I didn't mention any name. I just say it's trending, and I don't know if it's even true. Okay? But I just gave an example that people shouldn't live too big when their parents are suffering, their elders are suffering. Just bring them up a little bit to live better life also. If we have the means, let's not neglect them. Neglect is that. Thank you. Okay, so next slide, please. All right, so failing to provide or deliberately withholding necessity, hearing aids, eyeglasses, walker cane, wheelchair, medication, food, help in bathing, clean clothes, failure to provide appropriate physical precaution, failure. I said act of omission or commission. What you fail to do, it's important, equally important. Okay, next slide. All right, psychological or emotional, like threats of deprivation or harm, not on speaking terms with parents, getting alienated from parents, verbal aggression and name calling, for example, like nobody else wants you are useless, you should be grateful, I even, things like that. We shouldn't abuse the elderly. Next slide. I need you to stop behaving this way. Okay, next slide. Illegal or unauthorized taking or using of an elder's fund. That's financial abuse. Is also common. Some elders have worked and saved money. At a point, they can't go to the bank. So they send people. When their other children come, give them money. The caregivers or people around them steal the money. Is financial abuse. They make them sign checks. They go to the bank and they take back some of the money. It's financial abuse. Next slide. Okay, theft of money, possessions, jewelry, even their property, keeping the elder for their social security check, getting power of financial attorney, preying on the elder's gullibility, hopelessness, and ignorance. Next slide. Okay, so threat or intimidation. This is just showing a picture like that. Next slide. I want to tell us that the elders too are harmful. They can be a harmful. It's not easy. At that time, some become difficult. Many become difficult. Remember, there's a lot of decline. They can't hear well. They can't speak well. They become stubborn. There's dementia and much more. So they are also a harmful. Some become talkative, So isolation. Some are intellectually isolated, locked up, no visitors, nothing, just on their own. Give them food, they sleep. That's also abuse, isolation. Next slide. Okay, what are the causes? It's in combination. Sometimes domestic, physical dependency. Caregiver is stressed out. It can be stressed out to care for them. They even develop some health problems themselves. All right. So it takes a lot of patience and passion and strength also to care for the elderly person, especially one that has serious health challenges. Next slide. Okay. We've talked about domestic family violence pattern, pathological abuser, drugs and alcohol abuse, mental illness, abused children become abusive adults, mental illness, cultural dimension to it. Next slide. There are some cultures that it is nothing to insult an elderly person, to abuse an elderly person. While some cultures is like abomination. You dare not do that. So there is cultural dimension. Then there is institutional, like lack of training of the caregiver, insufficient staff, insufficient resources. Then the caregiver might be overworked. We talked about that. You know, it really takes a lot. We hear stories coming from abroad where people are taken to jail. As a girl that was convicted, she maltreated the caregiver seriously. They didn't know there was a camera in the room. You know, she was so pissed off. The person was needed to change the pampers, and they dragged the elderly person to the floor, remove the pampers, clean it. It was just frustration. And these are things they were not doing in Nigeria. They are not used to. Lack of training, insufficient staff, lack of passion, lack of patience, lack of love is also there. Next slide. Next slide. All right. So what are the risk factors? There are victim factors, caregiver factors, system or environmental factors. Victim factors, like the state of health of the victim. When dementia sets in, and even some like mental confusion, mental state is changed, setting, the victim becomes troublesome himself or herself. All right. Then the caregiver might be frustrated, might be an addict, might be a thief, might be a lazy person, just wants the work for money. Then the system factor, the system that is not rewarding the caregiver might be a factor. All right, next slide. There are a lot of things on chatbots. We'll look at it later. Next slide. Okay, the typical victim is the widow over 65 years old, insufficient income to live independently, increasingly dependency, cognitive impairment, especially if recent, more problematic behaviors, shouting, incontinence, wandering, paranoid, stubborn. There are some that cannot sleep without the lights. Oh, people are coming, they are coming, they want to kill person. Some become talkative, some become angry. Okay, so those behavioral problems, I think women exhibit them more. Next slide. Okay, elders cognitive impairment, dementia, less able to protect self, elder gets abusive, violent, socially inappropriate, poor health, elder requires much care, social isolation of both the caregiver and some people build big houses, especially in the village, get a caregiver to look after their old parents while they're in Lagos, they're in London, they're in Abuja, they're in Port Harcourt. So they become isolated with high walls, you know, so that is a problem. Okay, next, please. Next slide. Right, you can see this elder well dressed and is dancing and is ready to fight. So you can imagine there's a lot of dementia in this person. All right. Caregiver factors like history of violence or victim abuse, substance use, and other stressors. Yes. Environmental or system factors, victim and perpetrator in shared living situation, they are managing. It can be frustrating in one small square meter. They are managing, their living condition is not good enough. It can breed frustration on either the victim or the caregiver. Next slide. The perpetrator is financially dependent. So what do you do? Similar to screening for domestic violence, use open-ended questions. How do you feel about your safety at home? Who helps you at home? What happens is that you separate the caregiver from the victim and interview them separately. That's when you will know. And examine very, very well. Okay? If you need to make some phone calls during the interview, like calling children to ask one or two questions, you do that. So there are a lot of open-ended questions. You listen as much as possible. Observe the face of the elder person, the older person. Observe the body language. Examine very, very well. Are there marks on the skin? Are there bruises, fracture? Any sign that this person has been abused, you have to look at it. And when you are asking them, look at their face to know when they are trying to hide something or protect the caregiver, the abuser. It's possible, especially when the abuser is their spouse or their children. Next slide. Okay. When they say a typical abuser is a relative, 40% are spouses, 50% are children or grandchildren. All right. Of course, if they're children or grandchildren or spouses, they've been together for some time, at least 9 years. Okay, so they're under stress, alcohol or drug use, marital problems, social isolation, all right, financial difficulty. Next slide, please. You look for warning signs. I've said it before. Unfortunately, in this country, is not taken seriously. But even in developed countries too, it's just now they are beginning to report elder abuse. Okay, it's often shrouded in secrecy, dismissed even by authority. They will say it's a family affair. Okay. There's this program on TV they call Special Victims Units. So things like that are covered by this kind of. Okay. So the interview will give you some warning signs. All right. When you ask question and the abuser is always answering, rushing to answer, you slow down and say, no, I want this person to answer this. Abuser isolates elder. Abuser controls mail visit and phone calls. The elder appears helpless, confused, hesitant, and speak freely. Elder has insufficient food and basic needs. Elder exhibits poor hygiene, untreated medical condition, visible injuries. I've seen an elder person that was admitted in hospital. The doctors had to say, okay, please bring toothpaste, bring toothbrush. We need to do oral hygiene. And they had to clean the mouth, the teeth of this elder person themselves in hospital. They need to get nail cutters to cut the nails, do all those things in hospital. This is a very serious matter. And this is an elder with children, grown children that established have money. Okay. But then the wife with him, the young wife with him could not take care of. Next slide. So you make your diagnosis. Of course, there will be denial. No, he doesn't do that. He's always good with me. But you know what you have. All right. Yes. Next slide. Okay, also look for STI, genital injuries, depression, and withdrawal. You see, you need to ask some questions and you need to develop skills to ask questions so that it can be answered. Let me give you an example. You are clerking a patient, a woman. You don't directly say, how many children do you have? You can ask, how many children are at home? She said, oh, there are 3 children. It's she that is going to tell you that 2 are my own. The other one is my husband's own or my sister's own or my aunt's own. But when you are too direct, sometimes you don't get the right answer. How many children do you have? Are you married? No, you don't be too direct sometimes. You must develop interview skills. All right, next slide, please. Look for changes and some extremes like unkempt appearance, dirty or inappropriate clothing, or shaving face, uncombed hair, unusual or extreme body odor. And just look for signs that this person is neglected. Let's just use that word now. Neglected. Okay. Next slide. Okay, you can see marks on this elder person's face from beating. Okay. Next slide. There are still other things you can see on the body, on the skin, on the nails, on the body. These are all listed there, and I'm sure there are more. Next slide. Okay, so when you examine, you look out for injuries, bruises, look at the teeth, the mouth, pallor, all right? And if you urinate, do you feel pain? You want to take that kind of history, perineal history, penetration, sexual history, you can start with that. If you urinate, do you feel pain? Have you felt pain before when you're urinating? Is there any pain in your perineum? Like that. Has anybody touched you? That is how to go about it gradually and not be direct. Is he trying to touch you in your private parts? Just be gradual. It's okay. Next slide, please. Okay. So you examine, check for pallor, dehydration, that the person is not eating. Look at the skin, the person losing weight. This person depressed, withdrawn. Is the person cheerful? Look at the face. Next slide. Barriers. There are many barriers to reporting. One, like I said, if they are family members, they are likely not to report to protect the family, not to spoil the family's name. Okay. They also said if I report and they take this person away, who will look after me? So there are a lot of reasons to reporting abuse. But the doctor, the nurse, the public health expert, the social worker should be able to pick those signs and report appropriately. All right? And report appropriately. Some of us don't even know how the procedure for reporting. Okay? Yes. So those are reasons why there are no reports. Go ahead. Next slide. Some of us are hearing about elder abuse for the first time. We are not aware of such a phenomenon. Okay, the other barriers are this inclination to be involved in the legal system. They don't want police matter, you know. They don't want to label the abuser an abuser. The perception that the proof of abuse is inadequate, lack of professional protocols for elder abuse. All right, you know, once you report, the person will become more angry towards the elder person. So those are all barriers. Next slide. Next slide, please. Intervention. What do we do apart from reporting to police? Class, I want your response now. What do we do? What intervention can we do apart from reporting to police? I'm listing them and writing them down as you say them, please. Ikenna, you can start. I'm looking at other names. You go Chuku, Zainab. Please start talking about what we can do. What do we do? Intervention. What interventions can we do? Yes, class, come forth, please. Yes. What interventions? What can we recommend?
Community
Yes.
sensitization.
Community
Awareness.
sensitization, very good. Awareness. You know, all the media, you know, print media, electronic media, TikTok, Instagram, wherever you find yourself, give a talk in church, at the clubs, in the community, in the marketplace, in the hospital. You don't have to wait. After this lecture, you don't have to wait to pick up a victim or a case before you start talking about it. Teaching people, there's what we call elder abuse, elder neglect after this lecture. Thank you for that. Next, any other?
Education too, just like making them known about the privacy of the victim and both the caregiver, educating them.
Okay.
Okay,
All
Joe.
right, that's very good. Thank you, Stu. Oh.
Okay, good counselor.
Okay. Policies. Well, there's also need for government to come up with policies protecting the elders.
Pension should be paid. When people work, they should have pension, they should have gratuity. Yes, policies protecting the elders, providing things for the elders, you know, rebates, discounts, things like that, rebates, discounts, protecting them, free medical care, paying their pension, not when they go and take their pension from time to time. And of course, family members should not forget their elder ones. We should do the needful as much as possible. That's the social security we have. The social security we have is different from what they have in advanced societies. Our own, we provide the social security ourselves. Family, friends, neighborhood provide the social security. That's what we operate here. And we should, for now, that's what we have. So we have to practice it. More, please.
Set up a recreational
What
center.
about housing? Like in
continue.
Europe now, the elderly people, they have free housing, many of them. Even social worker is assigned to them. You know, many live alone. Social workers are assigned to them, free housing, they have telephone. They have all the basic necessities of life. Even when you don't have the money to pay, somehow the state will pay for you, take care of you. That is why they take tax seriously. Very, very serious. Tax they are like the enemy of the state. More, please.
Setting up of recreational center to actively engage them in physical activities and mental activities.
Yes, recreational centers. We should tell them walk or Run, no, not run these days, but at least stretch your legs, move. Recreational centers, be active socially. Be active. In my church, we have this choir of the elderly people, just them alone. They have a special choir. They don't minister every Sunday, but they do minister. So there is that kind of choir. And they go for choir practice, they go for meetings, they go for more. So we should encourage such things. We should encourage club. They should encourage socials. They should participate in socials. It's not only old young people that will go for all those activities that will go. They too should go where they are shaping and go. We encourage them, we take them. Okay? They should be socially active. It will help their mental state and physical state.
Okay.
Go
At the
ahead.
facility levels, various
Yes.
primary or secondary, there should be services for the elderly that dedicated for them
Yes.
also, so that both at all levels of healthcare services.
Rehabilitation, identifying the problem, removing them from the abuser, and rehabilitating the elderly.
Yes, thank you so much. You know, we also have home for the elderly. In Port Harcourt, we have one. Those, in fact, I'm going to talk with Professor Best so that we know some of you have to do some visiting wherever you are and make a report on it. Okay? So part of your CA is to do some visiting of some of these rehabilitation homes, and write a report and forward it. It's part of your CA. So there are so many: home for the blind, home for the deaf, elderly people's home, you know, prisons, there are a lot of physiotherapy, you know, so you write it up, and we want to see not just the write up, we want to see you with the picture, we want to see you picture of the where you when you are there. We need to see the picture. So you visit, then you write it up. The activities there and what you saw when you went and about them. Yes.
Okay, ma. Sorry, but can we also
So
use
class rep, reach me again. Let us fine tune this. It's part of your CA. All right.
Okay.
Okay, go ahead.
Doc, sorry, there is something I want to chip in here. We've been looking at will I say external things that can be done for the elderly, but I also think people as they age, they should also make preparations for their old age in terms of having a very good saving culture and living a lifestyle that would not impact on their old age. So I think in their old age. So I think we should also develop systems that will encourage people to prepare for their retirement or their old age. Thank you.
Okay, that is very good. But let me ask you, what is the percentage of people engaged in formal work that are able to do this? Let's look at it. Like Nigeria now or your state, what's the percentage of people engaged in formal work? Either they are self-employed or not. What's the percentage? It's small. It's small. Maybe with education now is increasing, but it's not much. So some people manage throughout their lives. So they eat from hand to mouth. They barely survive. So before you know it, old age has come. And of course, our society, our culture, we want to have many children. Taking care of one child is a lot, let alone 2, 3, 4, 5. Is a lot, you know. So they spend all their energy trying to take care of their children. Before you know it, old age has come. The industrialized societies that want to have 1, 2 children, they are not foolish. They are not foolish. One, they themselves need to survive. Then that child you are bringing up, you have to have a plan for that child. The child also needs to live life, enjoy life, and survive. So they will remember all that. Take them into good cognizance and then decide to have 1 or 2. Most of the time, maximum of 2. They are okay. But when you have 2 children, it's like you don't have children. So we need to start changing the mentality, the narrative that we need to survive. You see, our life expectancy is low because of such things. We need to survive, enjoy life, survive, contribute. be productive. That's why we're not productive. I'm not sure our brain is another color. But if we spend less time on rearing children, on some socials, and think deep, how do I make this better? I think we can live longer, we can live happier, the society will also be better. But we raise up so many children and we can't train many of them, and they are there in the streets, running loose, according to one song. So we need to communicate that. And how do they now plan for their future? It's difficult. Your point is well noted, it's true, but it's difficult for many. It's just few people that have worked and planned. Some of us will have gratuity pension, or if you are self-employed, you put in some money somewhere, or you have one or two landed property or whatever that you can draw with and eat over time. All right, so that's the truth. It's a good contribution thing. Yes, next.
I also think that the government at all level, local government, state government, and federal should look into
Yes, hello.
Hello? So I think the
Yes.
government need to do a lot. The government need to do a lot. The social security we have in Nigeria is very poor. And you said that we have some homes, elderly homes in River State, that they are not rampant in Nigeria. So because when we find out that an elder is being abused, we need to remove them from the abuser. Where are we taking them to? So all these homes need to be built, and even the people that will support these people need to also be paid. So the government is not doing a lot, and we are talking here that we need to support the elders. These elders, they once work with the government, they pay tax and everything. Why is the government neglecting them? Because the way we are looking at it as if is the children of the elderly need to do everything. The government need to do, because these elderly people also work for government. They contributed, they pay tax and everything, and they are not being cared for by the government. So the government have a lot to do.
I agree with you. Advocacy to government too. If I worked and I put my money for and I put my money a little every month down, I should be giving it, they should be giving to me when I've retired. If they want to be giving it small, fine. They want to give me gratuity, it should be automatic. It's not until some people die or they are sick and they know with age illness come. So why do you have to starve them of funds? Why? They should be a priority. They should be a priority. At least let them enjoy their end life. Okay, I agree with you. But like I said, our social security, our family, that's where we are for now. So that's why I said some people say they're entitled. Yes, they're entitled. That's what our culture preaches. They too, they stress themselves to look after us. That's the truth. They do. That's the truth. So that's how it is for now. Okay. So the government should do more. We can be advocates to advocate this. Some of us might be in places where we can speak up. We can change the narrative. All right. We can also, the families can also be talked about. You can quote, my lecture the other day, one of my lecturers was teaching us about this, and I think that's correct. And I've noticed this about your dad, your mom. Please let us do it better. Or about our mom, our dad, please, if you do this, my lecturer says it's neglect. Some of your siblings will say, go and sit down. But one or two will think about it, and they might increase the welfare package to their parents. Welfare package. I used to tell my children, if you have not called your parents for 2 weeks, so that's the truth. But once I say it, I'm sure there will be change. Next time I say the last 2 weeks, who has spoken with their parents, there'll be more hands up. So that's it. So let's just try. The list is endless. It's endless. But let's just try. And we pray every day for long life, isn't it? And longevity. Everybody does. That means we hope to get there. So if we hope to get there, then we should start preparing ourselves, our minds, and people around us, sensitizing them that old age is a reality. And So we need to prepare, not just logical wise, plan to help. Thank you. We pray for long life and longevity. List is inexhausted. It's just that some are very difficult. But I used to tell people, play your part as a child. As an offspring, do your bit. Don't be found wanting. Do your bit as an offspring. Don't be negligent. Even when they are angry with you, they don't like you like they like John more than Peter. Do your part as a child of so sound. So that's what I teach to people. I tell, all right. So next slide, I think we've come to the end of the slide for elder abuse. I want to read the charts that we have put on the boxes. There are many. Okay, in Bayelsa State, there's no elderly homes. Long life in good health, that we should live long life in good health. They say, does prayer work? Yes, pray, but pray and act, do other things. Monitoring and provision of quality meals, more old people's home, that we should show them love. In addition, I think people should plan for old age and retirement, correct? And environmental safeguards, yes. Health care-based interventions, yes. Health insurance, empowerment of older adults, public awareness, safeguarding issues, dancing elder, yes. Can you people allow the lecturer to finish before causing unnecessary delays with unnecessary questions? A chick that might be into runs just to take care of herself, plus we don't have a whole lot of information to judge her. Please let us set religious emotions apart in this. Well, I didn't judge her, but I just gave it as an example that some of us live big in townships, but our parents are complaining, and that greatly came to mind. But when they die, we bring in so much pomp and pageantry to the burial. That was just what I was trying to say. Support your parents and leave girlfriends alone. Some are aggressive, some elders are aggressive. Gege lecture. I don't understand what that one means. So Gege lecture. Okay. So those are some contributions. Deterrent system. No elder home in Uyo. Presently, in my region in Cameroon, we don't have elder home. The religious people should visit and start collecting dues from them. Okay, so they should stop giving offering in church. That's what she's trying to say. Home visit by healthcare providers. The insincerity is much. Fake prophets dividing homes and saying the parents are witches and wizards. Discouraging care of the elderly. Very, very true. Please don't listen to such people. Combat stereotypes and biases. Legal action should also be taken for elder abuse, yes. Elderly should be going for pension clearance always, even though they are ill. That's wrong. Insurance policy for old age. Thank you, doctor, for the lecture. Good night. Good neighborhood practice. Encouraging culture. With regards to the CA, what about those in diaspora? They have places to also visit. They have rehabilitation over there, even more. So they should write on something. Nutritional needs of elderly should be considered. All right. Now, let me tell you a story about a man that had a big house. He put a conditioner, got a girl to look after his mother that he was paying, put CNN for them. That was the story. So the girl will just be on her TikTok, on her CNN, and put on the air conditioner. The mother could not so mobile. And she's there, had pneumonia, and before you know, the woman died. All right. So we need to put an eye, not just, oh, I've provided for her, I've put her in a big house, I've got somebody, it's not enough. You must put your own touch. Okay, so thank you so much. And I'm hoping this will cause some behavioral change. They say if your parents neglect you and you struggle to make it in life, how then will you help your parents at old age? Can we answer this question now? If your parents neglect you and you make it in life, what do you do to your parents? Yes, did you hear my question? If the parents neglected the child and the child makes it in life, are you obliged to look after them? So let us have a parting gift. I think for today we should call it a day. But let's answer this question. If your parents didn't take care of one and the person makes it, what do you do with that parent? Please, I want input from the class.
Good evening,
Hello,
doctor.
ma'am.
Good evening,
Yes.
doctor.
Yes,
My name is
good evening.
My name is Henrietta
Okay.
Okon. Yes,
Yes.
even the Bible says when you respect your parents, your life on earth will be multiplied.
Your days will be long, yes.
It's painful that some parents don't think about the child. They will abandon the child, and after many years, God will bless this child. At the end of it, you expect this child to me. I feel I'll just do it. They are my parents, I'll just do it. Let God just be the judge. I don't want to, because people will still say, your parents are living in and you are in abroad. So what do? I'll still help them. I'll help them. And
I said, do your bit. Do your bit. Let God be the judge.
Let God be the judge.
Yes,
let God be, because people will definitely, if that person died, you still come back and bury the person, and people will be talking. They wouldn't know the reason why it was that way. So I will do my best for them. I will not abandon them. And please, I had a question that my hand was up since. I want to ask about abuse. We talk about domestic violence, we talk about abuse, we talk about sexual assault. And I know we have GBV, gender-based violence. We have NGOs that come in on telly, radio to talk about this, and it's being centered on female. I notice it's being centered on female, and the men are being overlooked. It's not like, so men are not being abused, men don't face domestic violence, but when you get to homes, you know that some men suffers more than women. And when you get to some home, you know that some men have become like maid for their wives. But they cannot speak out. You don't have anybody to tell your problem, and people are just like, okay, you're quarreling with your wife, she lifts up a bottle, and you trying to help bring back the bottle, it caught her, and you then rushed her to the hospital. People will be now blaming the man. You took her with the bottle, you are abusive, you are this. Nobody thinks about this man mental health or his emotion. So I keep asking a question. What will we do to save men? Because men are dying in silence, please. That's my question. What should we do to help these men?
All right. I think one of us will be taking you on gender-based violence, isn't it? There's a lecturer for that.
Okay, but
hasn't the lecture taking place?
No, ma. But you talk about abuse. So that's why, please just answer me when the lecturer comes. At least you are a woman, you have seen it, you've heard it. What is the way out for this men, for us to help them?
Okay, let me tell you. I'm an advocate for men also. I am thinking this way, not just for the violence. I've noticed that the life expectancy of men is dropping every day. Any day you hear about death, most of the time they are males. And the women will live 30 years after, 20 years after, 40 years after. So I'm advocating for men now. My last year, most of my lectures, I'll end up and say, please, the men around us, be them our husbands, our brothers, our uncles, they are not as strong as we think. that we should take it easy on them. They too should learn to take it easy. The men are always in a hurry, you know, everything is quick, 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 quick. They don't take life easy, slow, and remember their health. They don't. So I've started advocating also that we should take it easy on the men, starting with those that have husbands. Take it easy on your husband. They are not as strong as we think they are. That's why they are dropping dead more easily. Our uncles, our brothers, our classmates, our neighbors, we should please look at them differently, because me, I'm seeing them differently. All right. Then a man being abused by a woman, by his wife. Most cultures, that's not what it is. But I know there are some homes, that's what obtains. It's wrong. A woman should never do that. A woman should never, never do that. But women do that. Phew, maybe 1 in 100 or 1 in 200, I don't know, but it happens. I'm against it too. So we should speak up. When they teach you about gender-based violence, this question will be very appropriate, because in some homes it's reversed, but majority is women that are being abused. All right, that's the truth. Okay, so the man too should report. But when you go to report, the police people will laugh at you. The social welfare will laugh at you. Yeah, they don't believe you. They say it's the social matter. But you know that the man it's easier for the man to walk out of a relationship than a woman. That's the truth of the matter. A man can walk out than a woman. So that's the truth. They will not believe a man that he's been abused. That's the truth. The family side will not agree. So that's the situation. So as much as possible, let's see the men, treat them nicely, see them as being not as strong as we think. That's it. And they too should try to take care of themselves, do exercise, eat less, and don't be in a hurry for everything. Carry all the problems at once. You know, that's how men operate. Everything quick, 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 everything at once, always in a hurry. I'm beginning to speak against it. Please, I think this class too. Please, let's just take this. Men are not as strong as we think they are. Well, they are not as strong as they think they are. That's the truth. So thank you for that. Mm. Thank you for that. So that's a true story, you know. That's a true story. I'm trying to remember another story.
Okay. Ma, can
Why I
I,
don't
ma,
understand why there's a question
es-
on the chat box.
excuse me, ma, can I raise an issue?
Yes,
Yeah,
raise.
please.
Okay, yes, please. There's a trend that maybe we should also advocate for.
Okay, before you go, I want to remind us that the gene for longevity is on X chromosome, and the woman carries 2 X chromosomes. So you see, the gene for longevity is on the woman. It's more on the woman. That's what we must remember. So guys, you should remember this. And don't think we are superhuman beings. I'm strong, I'm a man. No, you don't have that gene, the much the women have. So slow down, take it easy, take care of your health, exercise. Don't eat too heavy, eat well, balanced diet. Don't carry too much problem on your head. I must build this house, I must buy this car, I must do this, I must do that, I must do this. No, some of you should be told to go with one woman at a time, not carry too many women that be chasing you here and there, and much more. Carry the much you can handle. Is the gene for longevity, you have half of it, half what women have. So I want you to research that. You know what I'm talking about. And also want you to teach other men. Share. Oh, what I learned today from my lecture. The lecturer was talking about that. And I've gone into internet, I've researched, it's true. Let us take our life more seriously, take care of it, protect it, on, you know, promote good health to prolong our lives. So that's what I want to be hearing. Most of the time, people start chatting me up too, even when they've graduated. Start saying, Dr. Ojule, I remembered it today. This is what I did from your lecture. That helped me to be able to do this, to be able to do that, to be able to guide somebody, to be able to counsel somebody, to be able to teach. that my friend has changed because of what I learned from you. My husband has changed, my brother has changed. So those are things I want to hear. All right, so sorry, you cannot state your point.
Okay, yes, my point, I think, is a counsel for men, even though I'm also a man, but we find out that there are a lot of men, because of economic empowerment, they tend to terrorize their wives. You know, they don't allow them to do much. The marriage is virtually a living hell. Then it gets to a time when the man is no longer as strong as he used to be. He doesn't have much money again. And perhaps the woman is at the prime of her life at that time. And then the tables turn, you know, and you now find out that a lot of these men who suffer what could be termed as neglect is something that they caused by themselves. When they had the power, they made the woman's life hell. And the woman cannot, in good conscience, at that old age, find it in herself to take care of that man because of all the bad memories she has. So I think we need to also counsel men. They have to be careful. They will not always be strong. You know, most often they are older than these women. They will get older quicker. They will get less strong, and then whatever it is they sowed will come back to them. They will have to repeat. So I think that's another perspective to that. Thank you, ma'am.
Doc, you're muted if you are speaking.
Yes. Okay, sorry. So the testosterone will also reduce. And then when it reduces, is that your wife that will be there? Others will run away. The side chicks will run away. The girlfriends will run away. The testosterone will not.
Your voice is breaking, ma.
Problem will come. BP problem will come. Diabetes problem will come. Is that your wife? So we, like he just said, we should treat our wives well, treat our spouses well. That's the person.
Hello. So it seems the doc has been knocked off by network. So maybe we'll just wait for a while and see if she comes back.
Now they took me out before I'm back. So I was telling a story of the man worked out on his family. Their mother managed to bring them up. They became successful. One of them is a doctor, married and was successful, even had a clinic. Unfortunately, their mother got sick and died. Their father came into their lives. The girl took the father into her life. The father is staying with her. And some of the aunties, especially the mother's relations, say, this man that abandoned you people, why are you doing this for the man? You know what she answered? Auntie, I'm doing my bit. It's my father, I'm doing my bit. The judgment is between him and his God. Me, I'm doing my own, which is a fantastic answer. So the father is living with that. She's caring for the man. Let the man, she's caring for the man, making him even live longer. Okay, so let's do our bit. That is going back a little bit. So men, let's treat our wives well. We pick them ourselves. Don't treat your wife like she's a servant. She's your wife. All right? That's the person who will run away. That's true. All those people that you fraternize will not be there. It's your wife. So let's take care of our wives. Let's see them as partners, not as house help. Okay? That's good. Okay, there's a question. Imagine that we have to justify men treating their spouses well. The reason is to treat your spouse well should not be considerations about whether they just do what we need to do. That's it. We pray that the table top women should do that. Okay. Okay. Any no other chat.
Doctor,
All right. Any
there's something I
more?
want you to.
Any more?
Yeah, there is something I
Yes.
want you to address. Somebody talking about, that this is academic environment. We are using religion to answer question. Can you address that? I don't think that's actually what you mean. I mean, if you go up, you see somebody that wrote Nigeria is such a way place. I just look at it and.
Okay. Let me tell us. This is social medicine. I don't know if I started this class by telling us the environment of men, social environment of man, and part of it is religion, communication, banking, schooling, and much more, all those things in social environment of man, which is largely made by man. When I was a child, you hardly hear the God on TV, or Oyibo TV. Let me use that word, TV. But now they're mentioning God. Just like you won't see a broadcaster those days wearing eyeglass. Now they are mentioning TV. Even in their movie, change it. There's nothing wrong with bringing religion. We are social beings, and religion is part of our social environment. So there's really nothing wrong with it. Okay? And we have religion or the other, there are so many. So let's not be shy about incorporating it into our discussion on health. There's nothing wrong with it. It's academic. There's nothing wrong with it. It's our social environment, and religion is part of it. Does that answer the question?
Yes.
What did the person say? You got to learn about Nigeria through what? Okay, can we just get it? You got to learn about Nigeria through what? What did the person say? Hello? Hello?
Hello.
What did the person say? You got to learn about Nigeria through what?
No, just
No, he's saying that Nigeria that no wonder Nigeria is not progressing, that we are using religion to make decision in academic setting. So, but the reason why I want you to explain is for him to understand it this way, that religion is part of us. There is no way we can completely exclude it in explaining things that happen in our environment and things that affect us.
I don't know where the person is speaking with, but even the Almighty America, religion is part of their constitution. It's part of their constitution. It's part of the academic environment. So I don't know where the person is speaking with now, but this is a social environment. Religion is part of it. Very much part of it. So the person should read up social medicine, social environment of man, and see the components that are there. Then entirely man-made. Everything social is there. All right. So let's not bring some sentiment. This is Nigeria. And the person happened to come to school in Nigeria. Why did the person say we're not progressing? We've tried. We're moving forward. All right. Any other one? I think we've done a lot today. The class rep should approach me. Let's get exactly the wordings for the CA tonight. You should chat me up. Okay? Let's get
Please,
it.
good evening. Some of us don't have all the people home. Please help us.
Thank you, ma.
That you don't have what?
We don't have old people homes in some of our states.
Okay, you don't have to go to old people's home. There are rehabilitation
centers.
I mentioned so many. It's not only old people home that you were talking about. There are other rehabilitation centers. There's one tomorrow, okay? Or next tomorrow. All right, more on rehabilitation, disability, handicap, definitions, and much more. I thought I had said that slide. All right, but this other abuse is very interesting. We should get awakened by it, know about it. And if we are perpetrators one way or the other, we should try to make amends.
Please,
so you have rehabilitation centers, physiotherapy, old people's home, home for the blind, for the handicapped, for spinal cord injury. They are all in rehabilitative medicine. Okay? So any of them that is near you, visit the pictures, write up what they do, all right, and what you have learned then. Thank you.
Hello, ma. Hello, ma. Good evening, ma.
Good evening.
Ma, please, I have a concern concerning the CA. From my own location, it's highly restricted or prohibited for you to visit those rehabilitation centers without having any of your relations there, because it's an Islamic it's an Islamic country. So I don't know. There are a lot of restrictions to your approach to one of the centers and all those homes.
Okay, let me tell you something. You write to them if you want school or public health to support your application. You write to them that you want to come and on a field visit. Okay, that you are a postgraduate student, you want to come on a field visit. You go officially, they will tell you what they do there. You don't have to take picture of the inmates or people there. You can just take picture with the staff. You can take picture with the signboard. Do you get what I mean? Then they will teach you what they do there. That might just be okay. Take picture with the signboard, with the staff, or anything there to show that you were really there.
Okay.
Doc, please, I want to suggest something. Is it also possible that
Yes.
we do a bit of something like a grouping? Maybe a group of people will go as a team to visit a center, That way we can, avoid multiple visitations.
Just a minute.
Yeah.
Are we in the same place?
We are not in the same place, sir.
If your governor
if
don't
you're in
have food to
Abuja,
go
for
to, let him build
example,
one for you.
Those in same
and
states.
there are 5 of you, you can go to one place. You can go to one place.
Thank you very much, Doc.
Good evening, ma'am.
Those of you in rural areas say there is no rehabilitation centers. Maybe the next township might have, or even if it's the local rehabilitation center, write about
Please,
it.
ma'am. Please,
Can
ma'am.
we
Good
go
evening.
to traditional bone center?
You can go and write about it. That's what you have where you are. Write about it. That's what you have.
Ma, can I go to SIPO?
Can you go to
SIPO, care for elderly unit patients at UPTH?
Can you go to where?
SIPO, care for elderly patient units at UPTH.
Patients at UPTH.
Care for elderly patients at UPTH. SIPO.
Yes, you can go there. Care for elderly people. We have physiotherapy department in UPTH. We have physiotherapy departments, rehabilitation centers. We have in UPTH. I'm sure many other big places, big hospitals also have. I'd rather you go to rehabilitation centers like physiotherapy department, speech therapy, audiology, all those. Okay, even if you go to the eye clinic where they are doing all those things, it's rehabilitation. All right? They will tell you what they do to rehabilitate people. Okay. So we are almost I think we can stop now. It will never end.
Thank you, Doc.
Hello, good night, please.
Thank you so much, Doc.
They are talking about consent letter. Yes, if you write to college or school of public health, they can give you something. Yes. They can give you a letter. School of public health requesting for online, they will send something to you. Yes. So please let us have behavioral change. Let us practice. Let us teach.
Thank you, ma. God bless you.
People need to pay me before I will teach them.
This is a wonderful lecture, my wife.
Thank you, ma.
People need to pay me before I will teach them. Oh, this lecture not be free. I'm not teach anybody for free.
Thank you, Doc, for the
Thanks, Doc. Good night.
Thank you.
Good night, ma'am.
Thank you, Doc.
Make una know all those women, una no pressure people here.
Good night.
Which one is pressure? Where about you people? Some men like you people are there supporting women.
You people should go home and sleep. Carry wetin you feed. No go carry wetin you no feed. That's what they talk.
Please, when are they submitting this assignment?
Shebi later you go say make money come back. No worry.
Carry wetin you feed, though.
Lecture is over. You guys should go home.